Hello, everybody. Welcome back to the Little Brain Campaign. I am your host, Dr. LaRose. I'm a board certified child and adolescent psychiatrist and adult psychiatrist with a private practice in Metairie, Louisiana. And in this podcast, I normally like to talk to experts from various fields related to mental health and physical health of kids and their caregivers. But I am going to do this episode all on my own today. I was inspired to do this by a couple of recent podcasts, most notably my one with Kirk Martin. If you haven't listened to that yet, please go back and listen to it because it's a really good one. But we talked a little bit about oppositional defiant behavior, oppositional defiant disorder. And it made me remember that I had been wanting to do an episode about this for a while and just couldn't find the time. So today I want to dig in on this disorder. If you haven't heard of this before, I'm going to read the criteria, the diagnostic criteria from the DSM-5, which is our most recent diagnostic manual that mental health providers use. So that you can understand exactly what it is. And then I'm going to tell you why I have a problem with this diagnosis. Okay, so oppositional defiant disorder, which is commonly known as ODD, is defined as a pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms from any of the following categories. And this has to occur with at least one individual who is not a sibling. So if these symptoms are only present in the context of sibling interactions, then the kid cannot meet the diagnosis. Okay, so here's the criteria. Angry, irritable mood, which is defined as often loses temper, is often touchy or easily annoyed, is often angry and resentful. Argumentative defiant behavior, which is defined as argues with adult authority figures or argues with authority figures or for children and adolescents with adults. Often actively defies or refuses to comply with requests from authority figures or rules, often deliberately annoys others, and often blames others for his or her mistakes or misbehavior. And then the last thing is vindictiveness, and that's defined as has been spiteful or vindictive at least twice within the past 6 months. And then there's like a couple of qualifiers on this, just about how there can't be, you know, any kind of psychotic or substance use disorder or like major psychiatric disorder that explains these symptoms. Okay. So here's why I really don't like this diagnosis. I'll just kind of touch on that briefly. Um, and I do not give this diagnosis to kids ever in my practice. I don't think I have given any kid this diagnosis since I left training because the vast majority of these kids, and I'm going to say all of these kids, it's just not that all of them get properly diagnosed. The vast majority have some kind of underlying psychiatric or neurodevelopmental condition. Okay, so research estimates 60 to 80% of these kids have an underlying psychiatric or neurodevelopmental condition. 20 to 40% apparently do not, but I would say that whole 20 to 40% has something else going on explaining why these symptoms are occurring. So, to go through the psychiatric conditions or neurodevelopmental conditions that we can see lead to oppositional defiant disorder, ADHD is present in 40 to 60% of kids who are diagnosed with ODD. Anxiety is present in up to 60% of these kids. And then some other common psychiatric issues that we see include depression, chronic irritability, which can be part of depression or not, learning disabilities, and chronic trauma or chronic stress. Okay, so like PTSD, basically. Okay. Another big one that, of course, if you've listened to this podcast before, you know that I'm very passionate about is an underlying autoimmune encephalitis, aka PANS or PANDAS. Okay, so one of the top criteria for PANS and PANDAS is oppositional defiant behavior. Now, by nature with PANS and PANDAS, technically that is supposed to occur abruptly and suddenly, if it's, really going to be qualified in the context of PANS and PANDAS. But I have talked about on previous episodes how there can be like a more what we call subacute onset of PANS and PANDAS where it's not, the kid is one way one day and then the next day they wake up and they're a different child. That definitely happens. But there's also a lot of kids who have more of a subacute onset where they might have one infection and some symptoms start, but they're not super noticeable to the parents at the time. And then they get another infection down the road, and that really accelerates the symptoms and makes them very overt and noticeable to the parents. So, for a lot of parents, they kind of have to look back and see, that there were some of these symptoms simmering in the background for a while. Okay. Um, there's also something else that I do think plays a big part in oppositional defiant disorder, and that is called temperament. Now, I'm going to explain what that is if you have not heard of it before. This is traits that we are born with. So these traits are identifiable in babies. Okay. So this is something that is hardwired in us. We do not choose it. This is not affected by parenting at all. This is just hardwired traits. Okay. So the categories for temperament are number one would be easy, flexible. So that's a baby that's generally happy, calm, adapts easily to change. These are the babies that get on a routine very easily with like sleeping, eating, going to the bathroom, etc. Okay. The next category is active, difficult. These kids are highly energetic, very intense, and they generally have trouble getting onto a consistent routine. So they're more irregular in terms of eating, sleeping, bowel movements. The third category is slow to warm up or cautious. These kids are more observant, more reserved. They take time to adjust to new people, new experiences. And so I definitely see, if let's say you have a kid who is the active, difficult type, that kid in general is going to get more negative interactions from the world, more negative feedback from the world because they're difficult, right? So adults are going to be more frustrated with them, whether that's parents or other caregivers or adults at school. And if people are constantly frustrated with you or disappointed in you or aggravated by you, angered by you, as a child, often that is going to lead to an increase in irritability, anger, defiance, oppositional behavior, etc. Because part of that is what we call negative reinforcement. So kids want attention no matter what it looks like, whether it's positive or negative. And so if they get mostly negative attention, it reinforces the negative behavior, unfortunately. Okay. So it will really bring out that defiant, oppositional behavior in those kids. So I think that temperament is also a big piece here that we probably don't talk about enough when it comes to ODD, because generally the ODD diagnosis has not been being given until elementary school age, and so we're not really thinking back to what these kids were like as babies. Other things that can contribute to oppositional defiant behavior would be family dynamic issues. So, divorce, separation, stressful life events like, a cross country move, a house being flooded or torn up by a tornado, death of a close family member, high parental stress or family stress. So maybe a parent is chronically ill, maybe a sibling is chronically ill, and so the majority of the parents' attention is diverted towards that other sibling, and the child with the oppositional defiant behavior may unconsciously be doing whatever they can to get some kind of attention. Um, maybe it's significant financial stress. Um, and then parenting issues can definitely be part of this. I think that, parents of kids who have oppositional defiant behavior are going to benefit from parent coaching regardless, not because the oppositional defiant behavior is necessarily the parent's fault, but because the parents are going to have to parent this kid in a different way than they would parent a kid who does not have oppositional defiant behavior. So it just requires a lot more creativity and focus on the parent's part as opposed to parenting a more easygoing child. Um, but having said that, I also think that too often, when we see kids who have this behavior, we assume automatically that it's because of parenting. Okay. And we fail to recognize that statistically speaking, the vast majority of these kids have an underlying psychiatric or neurodevelopmental disorder that neither the child nor the parent chose for the child to have. Okay. And so these kids are just more difficult to parent. Um, so, why do I not like this diagnosis? Why do I not ever, ever give this diagnosis? And this is just my personal opinion based on my experience. I find that when we give kids this diagnosis, there's there is this unspoken message that we give to the kid that it is their fault that they are this way. And I will tell you, no child wakes up saying that they want to be difficult and they want for people to be annoyed with them and they want for people to be aggravated with them and that they want to push people away. No child wants that. Behavior has a function and it has a purpose, okay? And sometimes we as adults don't understand why would a kid behave in a negative way to get attention instead of in a positive way, but kids don't have the lived experience to see it that way. They just want attention however they can get it. Okay? And so I think when we give this diagnosis to kids, we're putting blame on them for their symptoms. Um, that unfortunately creates this cycle of shame and guilt, which is never helpful for a kid. That does not help them to change for the vast majority of kids, okay? Especially if you have a kid who's chronically irritable or angry, increasing their shame and guilt, unfortunately, is most likely just going to further exacerbate the oppositional defiant symptoms. Um, I also think that, and this is something that I see kids who, come to me and they've been diagnosed with 5 different things. Okay. And oppositional defiant disorder is one of them. Unfortunately, that's generally the one that adults are most put off by and frustrated by, which I understand because it's disruptive to have kids who are defiant and oppositional at home and in the classroom. So I understand why it uh, it gets a lot of attention, and this is something that adults really want to go away. Um, but I also think that when kids get this diagnosis, adults kind of stop looking for the underlying problem. They're so focused on making the ODD symptoms go away that they forget to look for why the symptoms are there in the first place. Because truly, there's no way to eradicate the ODD symptoms unless you can identify the underlying reason why they're there and address that, right? Like you have to get to the why and the root of the problem and address the root of the problem. Because in my opinion, I think these ODD symptoms are just a giant cry for help. Okay, this is a way the kid has unconsciously figured out to get a lot of attention because they're trying to get an adult to help them. Okay, help them with these symptoms that feel out of control. Um, and instead, too often, instead of us as adults seeing that for what it is and helping the kid figure out what's going on, we slap this label on them and then we put them in the pile of kids who have behavioral issues. And we don't really do enough digging to help them. Okay. Um, the other issue is that if we don't figure out the why, the underlying problem that has led to these oppositional defiant behaviors, okay, if we don't figure out the why and we don't address that underlying issue, the child has an increased risk of developing something called conduct disorder, which is really what we want to prevent. Okay, so what is conduct disorder? So again, I'm going to read the DSM-5 criteria just so that you can get an understanding for what that is. So, conduct disorder is defined as a repetitive and persistent pattern of behavior in which the basic rights of others or major age appropriate societal norms or rules are violated, as manifested by the presence of at least 3 of the following 15 criteria in the past 12 months from any of the categories below, with at least one criteria present in the past 6 months. Okay, so basically it's just a pattern of behavior that violates the rights of others or breaks social norms or rules. Okay, so some of these possible behaviors: aggression to people and animals, and that's defined as bullying, threatening, or intimidating others, initiating physical fights, using weapons that can cause serious physical harm to other people, um, cruelty to people, cruelty to animals, stealing while confronting a victim, so mugging, purse snatching, armed robbery, etc. Forcing someone into sexual activity. Another category is destruction of property, so deliberately setting fires with the intention of causing serious damage, deliberately destroying others' properties. Another criteria is deceitfulness or theft, so breaking into someone else's house, building, or car, lying to obtain goods or favors or to avoid obligations, so basically conning people. Has stolen items of non-trivial value without confronting a victim, so that's like shoplifting. And then the last category is serious violations of rules, so staying out at night despite parental prohibitions, beginning before 13 years old, running away from home overnight at least twice while living in the parent's home or caregiver's home, or running away without returning for a lengthy period, and then truancy from school beginning before 13 years old. Um, so, there's a fortunately, it's not a huge percentage of kids with ODD who go on to develop conduct disorder, but it's not small either. So some of the research I saw said about 30%. So that's still a decent percent of these kids. Um, there's a lot of obvious reasons why we want to avoid the progression to conduct disorder in and of itself. You know, Another concern added on to that is that conduct disorder, which is a diagnosis of childhood, so this is only for children under 18, can progress to what we call antisocial personality disorder. Okay. And that's basically pretty much all of the criteria of conduct disorder in an adult. Okay. So if we want to prevent these kids from progressing to conduct disorder and then possibly progressing to antisocial personality disorder as adults, then we really need to help them figure out why they're having these symptoms and address that underlying issue. Unfortunately, we have this mental health crisis in the United States. We don't have enough mental health providers who can see kids, not nearly enough to meet the demands. So the few that we do have are very stressed and strained, and unfortunately don't have a lot of time or resources, which is a huge problem. Schools are stressed and strained. Parents are stressed and strained. So, there's not a lot of resources being put into these kids and time spent with them to figure out how best to help them. Um, so, what I would say that I wish could happen, I wish that instead of having a diagnosis of oppositional defiant disorder by itself in the DSM, I wish that each each of these underlying diagnoses in kids, like ADHD, major depression, generalized anxiety, learning disabilities, PTSD, etc. I wish that they had, what we call a qualifier at the end of the diagnosis that basically says you can have all of these criteria and have oppositional defiant features. And I think that little shift would force professionals to focus on the underlying condition and treat that rather than um, putting so much focus just on the oppositional defiant behavior. Um, I think that it would force providers to do that. And if this diagnosis became a part of an IEP in schools, it would also help the schools to shift their focus because, we see it all day long that if we see a kid has anxiety or depression or ADHD or a learning disability, we're much more sympathetic to them than if we think that this is just a behavioral issue. Right. And when we're more sympathetic to a child, we are much more likely to actually try to help them. So that's my 2 cents on ODD. Um, Let me know what you think. If there's any other specific topics that you want me to cover, either with a guest or on my own, please send me a DM on one of my social media accounts. Instagram is where we're most active. So please send me a DM there and let me know, and I'd be happy to dig into one of those topics. Thank y'all for being here. Thank you for tuning in to this episode of the Little Brain Campaign podcast. If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode. Please take a moment to leave a review while you're still thinking about it. It really helps grow the podcast, and I love hearing from our listeners. See you next time.